Dr. Steven Rosenberg is at the forefront of the fight against the disease that could kill 1 in 6 of us. His team has already cured some patients with melanoma, the gravest form of skin cancer.
This is the enemy. This is what we have to beat. This is what's growing in the bodies of our patients.
If they can find the answer for one kind of cancer, it could pave the way for the defeat of the world's most feared disease. Rosenberg believes that our own bodies hold the key to the cure. It lies within our lymphocytes, our white blood cells, if only they can be armed to battle the enemy within.
I saw a remarkable patient in 1968 that had a very dramatic impact on me.
Austin, Dr. Rosenberg. Everything went perfectly.
This tumor had disappeared in the absence of any therapy.
Good. Just rest up and leave the driving to us.
This spontaneous regression of his cancer has been seen in other patients, but it's one of the rarest occurrences in all of medicine. But somehow it seemed to me that this patient's body had figured out how to destroy his own cancer. And that, in part, set me on this search for the last 20 years to try to figure out how the body's natural defenses might be used to treat malignancy.
In 1985, Steven Rosenberg made international headlines when he proved that our immune systems can fight cancer. He was also the first to put foreign genes into humans, a development which has the potential to revolutionize medicine. Now, he and his team have identified some of the genes involved in the body's defense against cancer. In a unique new approach to finding a cure, they are inserting these genes into viruses, creating what they have termed cancer vaccines. In December 1995, they began injecting the first patients with these experimental treatments. Today, he is starting a brand new clinical trial. The patient is Kathy Helgens, a pediatric nurse diagnosed with widespread melanoma.
2 weeks. Kathleen Helgens. I think we've had a 54 form on her for 2 weeks.
So, 30-year-old woman with a very extensive disease, having failed the most extensive chemotherapy available and then some, who now has multiple lesions in her bones, in both eyes, her lungs, subcutaneous tissues, and a large lesion in her femur as well. Given the progression of this disease, it's asking a lot of this early stage of the vaccine. Okay, so let's go through from top to bottom what we're dealing with. You can see she has multiple lesions in the bones of her skull. Each one of these represents another cancer deposit, so this cancer is just wildly spread through her body. All right, I think we have a sense of what we're dealing with. Let's go see Kathleen. Hi. Well, sorry to take so long. Please sit down, Tom. Sit down. Sorry to take so long, but I wanted to be sure I understood all the details of what you've been through, which is quite a bit. I've heard your history, but tell me how you're feeling now. So you're tired, but you're also having some pain. Where is it?
I'm tired, and my pain is, the more I do, the more it hurts. Mm-hmm. And that would then be my left leg and my back, my lower back, mm-hmm. My shoulders and my ribs.
How active are you during the day? What is your general level of activity? I know you have a five-year-old, is that right?
4-year-old boy.
Right, 4-year-old boy, so that's a bundle of work. Are you able
He's
to
about
keep
all
up?
the work I do. I no longer do the laundry, the food shop, and the cooking. I don't do any of that anymore.
But you can keep up with the 4-year-old?
I chase him a little bit.
Okay, have you noticed the lesions changing? Any of the, again, I do want to feel these ones in the scalp again, but tell me about the others. Are they changing in the last month at all?
They're growing.
They are getting bigger? Mm-hmm. Have they doubled in size in the last month, would you say?
Yes.
More
Many
than
of
that?
many of them have doubled, maybe more than doubled,
Do you have any new ones?
and I have new ones.
And the new ones are where?
In the scalp, in the breast, in the arm.
Show me some of the new ones in the scalp then. Where are they?
Well, you know, like this one was fairly new. I mean, some I have had since
Okay.
July.
Right. Okay, so these are growing?
They're growing. Growing and hurting.
So these are painful as well? Okay. All right. Okay. You came to us at a fortuitous time, at a time right when we're about to get permission to use what we think may be the most potent vaccine we've developed thus far. We hope to immunize your body against the melanoma in much the same way that as a child you probably got vaccinated against smallpox. We have special permission from the Food and Drug Administration to treat you. We don't have formal permission yet to use it extensively. We're hoping to get that next Monday. But I was a little reluctant to have you wait another whole week before we got started because of the way this is progressing. Imagine how terrifying it must be for Kathleen to see these alien things appearing on her skin and growing, and knowing that they're growing in her body, and knowing that there's nothing she can do to stop them. It's a terrifying thing that patients go through, and especially as they go through treatments that don't work. And we tend to see those patients at that point. After conventional treatments have failed, they come to us very often having been told by their doctors at home that nothing more can be done.
Hi, Ms. Huggins. This is the consent form for the experimental vaccine. It's 3 pages long.
The vaccine
Any
Helgens will
questions?
receive contains the cancer-fighting gene
free to ask.
GP100 inserted into an
That's where you
adenovirus,
sign right
a
there.
virus which causes the common cold.
Alrighty.
And they hope to immunize you against your cancer and increase your body's own natural defenses against the cancer through that cold virus and the vaccine. That it is experimental, and, you know, although they hope it may help, they don't know if it will help. But it could benefit other people, too, just by learning from it.
You know, I'm probably the most impatient person you have ever met. I want to do everything today, but these viruses have never existed before in the course of evolution. They're laboratory creations. They have new properties that have never evolved normally, and so we do have to be careful with them. And when we first put foreign genes into humans back in 1989. That had never been done. No one knew what the dangers might be, and that was why we spent 3 years going through safety tests and regulatory groups before we could start.
Here we go. Little bubbles out.
Well, it took us 5.5 years to clone the gene, to sequence it, then put the gene into a virus. That whole process took about 5.5 years, and Kathleen, it can take about 1.5 seconds to inject. So.
And it will work.
Yeah, how long does it take to work?
And then hopefully a month or 2 to work. So.
Because Helgens is the first person ever to receive this treatment, the FDA has approved only the lowest possible dose.
Hopefully it'll be the best stick I've had so far.
That's right. You've had your share
Had my
of
share.
needles. They're probably in the hundreds by now.
Definitely.
Skin swab, and here we go. That's it.
Good.
All good.
It's all done. That wasn't even a second. That's good. You heard a lot?
No.
Okay, that's good. Okay, you just imagine all those lymphocytes chewing up all those tumor cells.
You can't imagine what I'm imagining.
Is that right? Okay. Kathleen, what we're going to do now is have you come in the hospital, and we'll have a room for you downstairs, and that's just to keep an eye on you. We're not going to be doing anything. Do you want to sit up? Good. Okay? Good.
That's fine.
Pull this in. There you go. I don't want you to be too concerned if you see things growing or something appears in the next couple of weeks. It's going to take that long before things start to work.
Okay.
Dr. Rosenberg's office.
In those patients that show a cancer regression as a result of our treatments, what's actually happening inside the body is exactly what we're seeing in this scanning electron micrograph, magnified 100,000 times. These lymphocytes, these immune warriors, physically attach to and attack this tumor cell and destroy it by injecting into the cancer cell a substance that will result in its destruction. And our challenge is to put the balance of power into these lymphocytes as opposed to the power that the cancer cell now has in most patients with malignancy. And so these are the warriors that we're trying to enhance. And when we give vaccines, what we're actually trying to do is increase the number of these cells that are capable of attacking the cancer cell.
Now you can come back slowly. You need a
When
blanket.
Beverly Pay came to the NIH 9 months ago, her skin cancer had metastasized. All other treatment had failed. The vaccine is her last hope. She's been given a high dosage of an earlier version of the vaccine, along with interleukin-2, which boosts the immune system.
If you'll bring your arm straight above your head.
It strikes everybody. It doesn't really pick and choose. You know, I've done things that everybody else has done lying out in the sun. I don't even know if that's the reason why I got it. But I just hope that this treatment will be a cure for me.
So Ms. Pay had her CAT scan this morning?
Correct. We got 3 points in time before she ever started the vaccine.
Right.
On Beverly Pay's last visit 1 month ago, she still had a tumor in her lung.
For her, what would be her fourth.
Okay.
When we started our treatment with Beverly, she had this lesion in her lung, which was growing. That was back in January. But if we look now at a comparable area, we can see a tiny little dot right over there that may represent the slight remnant of it. It certainly is, could be the end of a blood vessel now, but it certainly represents a dramatic decrease, if not disappearance, of this tumor. Okay, well, it's very exciting. So she's responding here in her lung and in her subcutaneous tissues. She'll be glad to hear that. She doesn't know this yet.
She doesn't know that yet.
Okay,
no.
well, we'll tell her when we make rounds.
Yeah.
Hi, Ms. Pay. Hi. What kind of day are you having?
Busy.
Are you? Good. All good news about the chest X-ray. That lesion we're following in the lung is gone.
Is it really?
Yeah.
Hallelujah.
You know, it was smaller.
Wow. That's fantastic.
Yeah, sure is.
Oh, that's great.
Really
Well,
wonderful.
Thank you
wonderful
all
news.
very much.
At any rate, wonderful news.
Yes.
We're
thank you.
preparing the vaccine now, and I'm going to give you the fourth injection.
I am going to have
You
a
are
Beverly
gonna get
Pay's
the fourth
cancer
today,
began
and
to
the
disappear
IL-2
after her first injection.
will start tomorrow.
Okay.
Now, one question. One of the things we're trying to study is whether or not your body's actually reacting to this virus.
Right.
To do that, we need a tiny little pinch of normal skin. We could freeze it up and just
But
take off
why
a
the
tiny
treatments
little
work
bit.
for
It has
some
nothing
and not
to
others
do
is a
with
mystery.
you
Studies with patients like
directly,
Beverly
except
Pay
in that
may
it'll
help
tell us
solve
whether
it.
or not your body's actually reacting
Right.
against
Yeah.
it.
Oh, help yourself.
Is that okay with you?
Sure.
Okay. Yeah, it's very, it's wonderful, obviously, and very exciting to see the tumor disappear, and it's some of what keeps you going in doing this and taking care of patients like Kathleen, who have a lot more tumor than Miss Pay has. And so it's very exciting. I just wish when I was thinking about this late at night, I thought more about Miss Pay. I tend to think more about the patients that don't respond than the patients that do, but this is the kind of thing that keeps us and the whole team going.
I'm just very happy that I'm one of the people that helped. It's fantastic. It's like you fly high.
Beverly Pay had a very aggressive cancer. She had had multiple excisions, which had removed all the tumor from her arm and had no tumor left. And then all of a sudden it started to grow again, and she began to notice these nodules growing right out of her arm, very frightening to her because she could see them grow from week to week and getting larger. And she's one of those patients that had just a remarkable disappearance of her tumor. You can see these areas where there used to be large tumor nodules, which now are gone. Okay, we have a challenge for you today. We have 5 patients actually, that we want to treat. But it's going to require getting every last drop out of the vial. is if we have enough, I'd like to give Ms. Pei a 4th injection at 10 to the 10. It's not absolutely essential. She's already had 3, and that's probably as many as can be effective. But the NIH is quite a remarkable place. Everybody is here because they want to try to not practice the medicine of today, but develop the medicine of the future. It's a very unique group, very dedicated group of people who are here because they want to make things better. Part of what keeps us going is the fact that we actually are working literally round the clock in the laboratory to try to find things that may help patients who have no other alternatives open to them. The toughest part of it really is ever leaving here. Does anybody have any announcements this morning? Once a week, our entire lab group, all our scientists, technicians, animal caretakers get together so everybody can hear what's going on and we can exchange ideas.
Another gene which is involved in the body's defense against cancer has been found by immunologist Paul Robbins.
How to clone these antigens is that we really need to understand the mechanisms involved in generating these antigens and why.
What we heard today in lab meeting was actually quite remarkable. What Paul described would have been unheard of 10 years ago.
To develop more effective therapies.
I mean, it's basically what used to be a decade of work now compressed down into a month.
You make it sound like it's so easy. I mean, I don't want everybody to think that they can just run out and do this in their spare time. I mean, come on, you know, we gotta. There was a lot of work involved in doing it.
But it is quite remarkable. We've been trying to identify what it is on these malignant melanomas, these cancers, that the body recognizes as foreign. Those are called antigens. Up until 2 weeks ago, we had identified 6 different antigens, MART1 and GP100. The part of our vaccines are 2 of those 6. But in the last 2 weeks, we've actually identified 2 additional genes. The one that Paul Robbins described today, and then Dr. Wang has actually found another one last week. So we're at an explosive phase of this development. We're actually identifying the genetic material that we need to use as targets for our vaccines. Hi, good morning.
The day after her vaccination, Kathy Helgens has had no side effects from the injection, but she has had a bad night with her cancer.
Big crowd this morning.
Big crowd.
Tell me what happened to you last night. Did you get some sleep?
A little bit.
Any troubles? Tell me what happened in the evening.
I ate a little for dinner.
Uh-huh.
I ate 2 little things that probably were wrong. I ate a potato and a little bit of salad. And I ate 2 French fries of his. And then I took pain medication just from my back, and my leg was bothering me a lot too. But about an hour after that, I had severe abdominal pain and broke out in sweat.
Where was it? All over your belly?
Like mid.
Show me where that was. So stay away from any kind of fried foods for the next month or 2. I can feel the gallbladder maybe a little bit large. You feel it right where I am? Okay. So since you're going to be here, I'd like to just learn a little more about it. In the event it starts causing more trouble, we'll know what to do and just get what's called an ultrasound exam. And then we'll try to get you home today.
Okay.
Good. All right, we'll see you again a little later.
Okay.
Okay.
Thanks.
How are you holding up? It is exactly like a detective story because what we do is we follow clues. So, what do we have? We get clues in the laboratory, we take them to the patient. We make observations that we then take back to the laboratory and then back to the patient, slowly trying to track down this killer. So what do we got? Did it work?
Yes. Yes, definitely it worked. In every case, post-vaccination is higher than pre-vaccination.
Now, what are these?
Those are T2s.
Right.
The next one's T2 plus 2M,
right.
then T2s alone.
You're kidding. This is incredible. Well, that's T2 alone?
T2 alone.
Look at this. This is astonishing.
It's still too numerous.
Dr. Helen Pass has found that in the lab, lymphocytes taken from a patient treated with one of the vaccines are amazingly active against cancer cells.
Now look, after immunization, we see beautiful dots. They really are beautiful because it's quite remarkable to think that each one of those represents an individual cell recognizing the cancer.
When you think that when
One
we
of the great
normally
challenges in
got
curing
this kind of
cancer,
reactivity,
however,
we'd have to, what,
is that
3
some approaches may
sensitizations?
work beautifully in the lab, but not in
Right.
people.
Whereas here, after his vaccinations, we can take it right out of his blood and see it.
Another diagnostic test has been ordered for Kathy Helgens.
My concern is that she's got melanoma in her gallbladder, because that's not an uncommon sight. Let's just see what the ultrasound shows. Maybe she has a stone.
Is that sludge in the bottom of it?
Sludge and also
Melanoma is the most rapidly increasing cancer in the United States. It is also one of the most deadly. It has a terrible ability to spread from the skin to other organs.
Stones, but just like it sounds, sludge. It's thick, wonderful, isn't it?
Are you going to tell me anything else about today?
How is the pain?
It doesn't matter. It's on a back burner right now anyway.
That's on our back burner right now because we just want to.
I just want to do the vaccine and get done.
this is the left portal vein coming in right there. She does have few lesions within her liver. She's got multiple lesions throughout the liver.
Kathy Helgens' cancer is furiously aggressive. It has now reached both her gallbladder and her liver.
We're just about done here. Looks like she's a little uncomfortable with this, so I think we learned what we need to know. How are you doing? It's been a long day for you, hasn't it? We're almost done.
Max Wilkerson, 248, Max 248.
It's sad for the younger people to get cancer and maybe they go through a lot of treatment and they're helped, or sometimes they don't and they die and leave little kids and everything. But I don't, I would not like to die, but I've had a good life. My kids are grown up. We've done a lot of things. We've had a lot of fun. And so I rather, well, I don't want to say I'd rather, but I would rather be a young person to get the benefits than me, if it came down to that, because, they've got a whole life ahead of them.
Justin's here.
Hi, how are you?
Today's the day.
Today's the day. Ready to go home, huh?
Yeah, 3 o'clock this afternoon we can leave.
Jane said you only had the 4 treatments?
Yeah, and they told me today that they gave me the last of the vaccine. There's nothing left.
Oh, is that right?
Yeah.
Beverly Pay is leaving the hospital cancer-free.
I thought it was going to go on for a long time.
I caught a few more ailments while I was here. I'm getting out, you better believe it.
But Kathy Helgens will have to wait to see if the low dose of her new vaccine is working.
I hope she does really well and feels better.
Hopefully she'll feel better than today.
Yeah, right. You gonna use these? You use that to carry your pocketbook?
You don't want me to tell you what I can do with these. But he said to come back in 3 weeks.
3 weeks, not a month.
Well, I don't know what he said.
Right.
My retention today is a little short. I'm a little stressed.
Yeah, it's okay. You can see that.
You always have this feeling that you're running behind the cancer. And I never want to get that far behind it that I feel like I can't beat it.
In scientific research, years can go by with few results. But in the past 5 years, the understanding of cancer has moved ahead with stunning speed.
Where we're at the top of that roller coaster, we have a lot of things to try as we engineer these genes into a variety of viruses. Adenovirus, fowlpox virus, we're putting into vaccinia virus, which is coming along as well. And the possibilities of combining these to continue to boost immune reactions is very exciting. It's never been tried before. These genes have not been available before.
Nine patients have received increasingly higher doses of the same vaccine Kathy Helgens received. None have had side effects. The FDA now gives permission for Dr. Rosenberg to move to the highest dose, along with a course of the immune booster, interleukin-2.
How many new patients we have last week?
The candidate is a builder with a 3-week-old baby.
You see any new patients?
John Chicalise. He's a 35-year-old gentleman with metastatic melanoma diagnosed from a mole in his right neck in June of '95. He said he's had a long history of sun exposure since high school. He's married, not even 1 year yet.
Is he here? Yeah. Can we come in? Yes. Chicalise, hi. Well, I've been hearing all about you and looking at all of your x-rays.
Okay.
I understand you had an operation here where they took out some of the tumor, but now it's come back.
Yeah, that was.
Is it causing any symptoms at all?
Oh, it just makes it so I can't move my neck too much. I'm afraid to move my head over to this side. This side's all right, but it's such a big, like, tumor here. It's
All right. What I'd like to do is just check you over real briefly, and then we'll talk about plans. Let me just slip you out of this. Just try to keep your head straight towards me and bring your chin down just a little bit. That's good. Is that painful at all?
no, I don't. It's
Any other moles on your body that have changed recently?
no. That's why I look in the mirror constantly, and I know my whole body, so I look for anything looks new.
Okay, we're gonna have you get dressed, then I'm gonna come back in and we'll talk things over.
Okay.
Okay.
All right.
Okay. Well, I'd say it's a perfect candidate for the treatment. So a bone scan and a brain MRI tomorrow.
Yeah.
And then he'd be ready to go. So we could potentially inject him tomorrow and start his IL-2 on Saturday morning.
Right. It'll be late, but we can inject him tomorrow evening.
Okay. Good. All right. Good. Mr. Chicalise, we're back. The reason the doctor sent you here is that we've developed new kinds of approaches to treating patients with melanoma that take advantage of stimulating the body's immune system. They involve an injection of a virus into which we've put a gene that causes your body to react against something on that cancer. And then we give you something called interleukin-2, which you may have heard about. It stimulates the body's immune system also to react against the cancer. And hopefully the two together will work better than either one alone.
Think you could go down the slide?
I got Mom.
Okay. Woo. Come give me a push on the swing.
Okay, just take it.
Okay.
4 of them.
You get bad news, and you cry over it, and you cry it out, and you give yourself a little time to feel rotten over it, and then you get up again. I have the most wonderful little boy that I want to do things with, and I have a wonderful husband and the best family you can ask for in the world, and a lot of reason to keep getting up out of bed. So it is a roller coaster, but I'll just keep fighting it. Every spare moment I have, I'm trying to think of all my white cells just attacking every little piece of cancer in my body. And it would just be the most wonderful miracle in the world if it could stop it.
Oh, time out.
No.
Time out. Okay.
The alternative stinks. The alternative is not acceptable.
It took years to complete the FDA approval process for the trials underway with Helgens and Chicalise.
See, the problem is if we don't get permission to do this, then we'll run out of virus before they have a chance to test new lots, and we're just going to have to stop what we're doing. So I'm just anxious to... Plus, you know, again, we've shown we can go to 10 to the 11 with no toxicity. It's so frustrating to have all these...
Rosenberg faces ongoing discussions with the FDA every step of the way.
This week, because that's the other thing that, you know, when we run out of the adeno GP100, we'll want to get started with the Fallopux. That's super. Okay, you'll drop me an email when it finally gets in? Jay, thank you again, as always. Bye-bye. Okay, we're trying to convince the FDA to let us use preparations of the GP100 that don't meet perfect specifications, but meet almost perfect specifications. And, you know, our patients with advanced cancer, it's either getting something that's almost perfect or getting nothing. So it's the problem with some of the preparations we have, I think, will not impact on their effectiveness. And so it's always a constant tension between doing what we need to do to help patients who are desperately ill and doing things that are safe. And have to strike a balance somehow.
We're gonna get the scan started here.
Does this machine go down past my 13-inch shoes, or?
John Chicalese, like all the patients, must undergo a series of tests before he can receive the vaccine.
How you doing?
All right.
Okay, they treating you okay?
Yeah, they are.
Good.
Okay.
Look a little tight under there.
Oh, it's pretty close.
All right. How much longer do you have?
About 20 minutes.
Yeah, okay. All right. I'll be back. You're doing fine.
Okay.
Good. Okay. Mr. Chicalese, MRI, he just finished it?
Yes.
Okay, these are the last studies that would determine his eligibility for the vaccine protocol, and looks like they're negative, which means that we'll be injecting him this afternoon.
But there's a hitch, a disturbing shadow on the brain scan.
Jan has an eagle eye when it comes to these brain scans. I don't know what that is. Doesn't have any edema around it. So
This could make the treatment more dangerous.
vascular shadow. We're going to send Mr. Chicalese down to get a repeat MRI. It looks like Nick Petronis is questioning the same thing that you questioned.
Yeah.
And although his fellow thinks it's a vessel, he's more concerned. So we're going to, before we do anything, we better send him down and check.
So we can do that this afternoon.
I just talked to him, and he's going to put it on as an emergency because I told him we wanted to inject him. We'll probably treat him anyway.
Does he know?
No, I'm going to go talk with him.
Yes.
And just tell him we're going to go down and repeat that, and then we'll know what that shows hopefully within the hour.
Okay, so you...
Eagle-eyed Jan. So we ought to send him down right now.
Yeah.
Ron, you'll put in the request? Yeah.
She is. There's a patient, John Chicalese.
The working diagnosis is a tumor metastasis. That's the first choice.
Radiologist Nick Petronis is concerned as well.
Do you see anything else in the brain?
No,
That's
nothing
it.
else. That's
Just
it.
that.
That's only one.
Is it in a silent area?
It is in the right temporal lobe, yes. It should be a silent area there.
Okay. Well, again, it's not going to stop us from doing this because if it is tumor, it's a tiny tumor that's asymptomatic. It has no edema surrounding it, but it certainly makes his situation much, much more difficult with spread to the brain, if that's what this is. It's tiny, it's solitary, and I'm not convinced yet. It's only one of the possibilities, but it's clearly not something we're going to have to follow along.
Just sit there, get your bearings. How you doing?
All right. This is what cancer does. So that's the enemy. We got to attack it wherever it is. And it's conceivable that these vaccines will attack it in the brain as well. But that's traditionally a more difficult site to treat. Well, let's see what the rest of it shows. But given the absence of edema, we're going to treat him no matter what. Okay. I'm glad that we're giving you at least as high a dose as we're able to go. That's it.
One of the softest shots I had today.
All right. But we're going to start in with the IL-2 first thing tomorrow morning.
Okay.
We'll be giving it every 8 hours into the veins. Sometimes after the first injection, you have a little bit of chills and a little bit of fever. We'll give you some medicine for that if it occurs. And after the first few doses, that stops happening, and you should be pretty comfortable. Some people have more side effects than others, but we'll be keeping a close eye on you.
John Chicalese is about to start his interleukin-2 drip.
Okay, this is your first dose of IL-2.
IL-2 is a human hormone which increases the number of cancer-fighting lymphocytes. It can have temporary but dangerous and frightening side effects.
Okay? And when it finishes, it'll beep 3 times and then switch back to your maintenance bag. Okay.
Mm-hmm.
For the Helgens, it's time to return to the NIH to see if Kathy is responding to the new vaccine.
Should be there probably about 10 o'clock.
Just get in, or you drive in yesterday?
Yesterday.
Tell me what's been happening to you in the last few weeks since we talked.
I'm still tired.
Okay. Uh-huh. Eating?
Drinking. I do think that, you know, nothing has grown the way it did without any treatment. You know, the way it did while I was on the radiation.
Well, that sounds like good news, though.
Well, I'm pleased
good.
because
Okay.
I do know it, you know, they, like I said, why we were so anxious to get started.
Child okay?
Yes, he is. That's why you have to help me beat this.
All right. We'll
Okay?
We'll do our best.
Okay.
All right. Good.
On each visit, the patients must undergo a process called apheresis, which removes their blood cells for testing.
What we're doing right now, Kathleen, is we're starting to take the prime solution out of the machine and start collecting your blood. So you may feel some cold solution in that left needle in your arm, and at that point thereafter, we'll start collecting your blood cells. What?
What do you need?
I need your love and support.
Okay.
By my side. Yeah, so far we're doing just really well.
Her blood is taken back to the lab where the lymphocytes will be separated. The cells will be tested for their ability to react against the cancer and will also be used for other research.
Well, I can tell you right now, just from looking at them, that they're certainly no bigger.
Well, I'm glad to hear that instead of possibly a little bigger. I will drive them crazy with my eternal optimism.
That's okay. One more measurement here. So I'm not measuring much change in any of these.
No bigger is good.
I'm happy with no bigger.
Yes.
Now,
Still, last month I was on nothing and they were growing. This month I'm on something and they're not growing. You know what? I always wanted to go away. Obviously, anybody would. But I've come to see that stabilization at this point is just as good.
exactly. Just as good if we can just keep it stable, and
Exactly.
you can live with this.
So, you know, if they've stopped growing from last month, that's partly what I'm asking for.
Exactly. We'll get the CAT scans and we'll take a look.
Okay.
Anything else I can do for you right
Nope. Thanks for measuring.
You know, in my experience, the worst thing you can do to a patient is take away their hope. Cancer patients will tell me often that their worst moments were not when they found out that they had cancer or even that they found out that treatments weren't working. The worst times they've ever had is when doctors have taken away their hope.
After Kathy Helgen's blood has been separated, a thin white band of lymphocytes appears in the middle of the fluid. However, it will still be some time before results are available.
Those CAT scan people are behind schedule.
Kathy and Tom Helgens are waiting for yet another test, a CAT scan of her entire body.
It's very difficult to do, especially when you consider most patients who are having these tests don't feel well.
You are the worst patient I have.
But I'm the best wife you have.
Yeah, it's true.
So things balance out in the long run.
To tear you apart just waiting.
It's one of the hardest parts. Maybe this time.
Maybe.
Don't you feel good about the few things you've seen?
That I do.
During the CAT scan, the patient must remain completely still. This is a particularly anxious time, not knowing what the tests will reveal.
Well, you know, in summary, I think we're not seeing any shrinkage. I think that the lung is about the same. I think we're seeing things in the liver now that we weren't seeing before, but we knew they were there from the ultrasound, and I think it could be partly a technique difference. My general impression is that things have increased a touch.
How you feeling?
All right, I took something for vomiting, so now I've been sleeping.
Still sleeping?
This is the second injection, Kathleen, so it's going to be just like last time. 1, 2, and 3.
There is no way to predict how many doses of vaccine will be needed, if Kathy reacts at all.
Remember the routine, don't move this.
You guys weren't in any rush to go home, were you?
No,
Think you'd like to stay here another day or two, wouldn't you?
No.
We wouldn't mind having that.
I know, it'd be very nice, but home sweet home.
Okay, you're
I won't take it
You always
personally.
want me to stay longer.
I'll be talking to you. All right. So that's it.
Okay.
Second injection, and you come back in 1 month, and we'll do it all over again. Something
I'll
to look
be
forward to. Okay. I'll be here too.
Yeah. Okay, let me hear about John.
John Chicalisi, he received the Adeno GB100 vaccine on Friday, and he started on high dose IL-2 on Saturday morning. After the first 2 doses, he had a little bit of low-grade temp, 38 degrees, and chills.
After several doses of IL-2, John Chicalese is experiencing typical side effects.
Hi there. All right. Well, you're starting to feel the effects of this? It's okay, you can just stay right where you are. How are you doing?
All right.
Good. Well, on paper everything looks good. How are you feeling in the flesh?
Flesh? My eyes are a little stuffy.
Well, as we mentioned, one of the things the interleukin-2 does, it tends to cause you to hold on to some fluid, but everything comes back to normal when we stop. All right, well, you can't do better than you're doing. I know.
Actually, it doesn't feel bad at all.
Yes, Dan, you have some pictures of your baby you were showing everybody.
Yeah, it was.
You have them here?
Yeah, I do.
Can I see it?
Yeah. There's one over here.
How old is the baby?
It's 3 weeks, a little over 3 weeks.
This your first one?
There's a picture of my wife.
I see. How's she bearing up under all this?
She's doing pretty good.
Uh-huh.
And there's my little girl.
My. That's a little girl, huh?
Yeah.
Daddy's girl, that's great. Her name is?
Julia Lynn.
Julia Lynn. Oh, what a sweetheart.
Yeah.
I have 3 daughters myself.
Uh-huh.
There you go. Good, well, thanks. All right, we'll try to get you back there as soon as we can.
Okay.
On weekends, Dr. Rosenberg maintains the experiments himself.
I don't get to have a lot of fun in the lab, but this is the most fun you can have, is working in the lab doing these experiments. I don't get to do it as much anymore as I would like, but I'm just actually feeding these cultures. Much like a human, these cells require adequate nutrition, elimination of wastes, and need to be cared for quite carefully or they don't do well. And if they don't do well, our assays don't work. And we're just checking the lymphocytes for their ability to recognize the tumor. They really require exquisite care. They're like very temperamental babies. And if you don't treat them just right, they act up.
John's wife arrives to take him home.
How you doing? You made it here.
I promise I won't cry.
I'm doing all right.
She's crying too.
She's crying too.
He's completed his course of IL-2 and the swelling has subsided.
Except for little shakes I just had and a couple little dreams. So I'm ready to...
He will be back in a month for his first assessment.
Hey, Julia. How you doing? You been a good girl the whole trip?
Okay, admissions?
Kathleen Huggins is coming in today.
What's her schedule? She's having her scans today?
So apheresis tomorrow morning.
Okay. Mr. Wheat.
Mr. Wheat is a 47-year-old man with a locally aggressive and recurrent melanoma on his scalp, metastatic to the skin of his neck and questioned to the lung. He came to the NIH on July of 1995. with these skin metastases. on the
Sidney Wheat is a patient who is generating special interest within the team.
A single patient compassionate exemption request for Sidney Wheat, which is being
His lymphocytes showed an amazing ability to fight tumors in preliminary lab tests, giving the team a whole new idea for his treatment.
next week. One of the things that we know from all the lymphocytes we've been taking off you is that your body got very highly immunized to those injections that we gave you.
That's good news.
That's good news.
Okay.
And so we've been working on something new to do. And it looks like your cells might be the perfect ones to try it on, to try to develop a better treatment to get rid of this. What would be involved would be to take the lymphocytes out doing the pheresis and educating them outside the body, the way our laboratory studies have taught us, so that they become ferocious attackers of the cancer in the test tube.
Okay.
And then just giving them back to you, just one day at a time over the course of 4 to 5 days.
Very good, Kathy. How you doing? Okay. Now I'm going to do a pilot. This is only going to be 4 seconds long. Okay, here we go. Oh, he's here. He's been here the whole time. He hasn't moved. It's going to lower the table, okay? We're all finished.
On this third trip to the NIH, the CAT scan has been an ordeal for Kathy.
You did a great job. It's okay. I just have to hold it here because this.
Doesn't move.
Oh,
How's she doing the last few weeks?
In the last few weeks, she's really deteriorating, taking in less and less by mouth. And over the past couple of days, she's becoming more confused. She can't finish her sentences. She loses her train of thought. And the sad thing is she realizes this, and it upsets her even more.
When the results of Kathy's scan come in, they're devastating.
Let's just go sit down here for a second. We'll sit down and talk with Kathleen also. In addition to seeing things grow, there are now 2 lesions in the brain that weren't there before. And I think that's in part accounting for her confusion. But I think we're now entering a period of decline that obviously you're seeing, and we need to start dealing with that more. She's shown tremendous courage and strength through this. I'm sure the trip down here was a really tough one for you. This just remains an unsolved problem right now. And these new approaches that we're developing in these earliest stages, and the early stage that Kathleen received it, just weren't enough to help her. And so what I need to do is tell her about this and talk with her and reassure her about the symptoms. We won't give her any treatment now, I'll tell her that, but I don't want to close the door on that completely. Do you have any questions about any of this?
Not really. I was kind of figuring it was coming.
Yeah, it's a terrible tragedy. I wish we could do more. Just impossible to predict the course of these things. But Kathleen has had the best of everything at every step. I mean, nobody could have done more, and I can tell you we're all inspired to see the way you're supporting her. Okay, let's go talk with her.
Please support the 12-1. Ms. Enid Silverton. Please support the 12-1. Thank you.
Hi, Kathleen. Want to sit down and go over things. We've had a chance to look at all the X-rays. Let me just pull up a chair here. We see some new findings in the brain that may explain the confusion, in that we see 2 small lesions in the brain that we didn't see before. But it does represent something new that's appeared despite the vaccine that we're giving you. And I think we could tell from the way these are growing on the scalp that it's just not controlling the growth of the tumor.
The symptoms come on within a week.
Yeah.
Just boom.
Well, I think these things have appeared in the last month, since the X-rays we had in May did not show the lesions in the brain. One of the things that I want to emphasize is that we can control any symptom that you have. There's no reason for you to be in pain. I don't want you to be in pain at all.
I just had hoped it would work.
Tumor is just very aggressive, seems to ignore all these manipulations that we've been trying. For now, there's just not a lot more that we can do.
Using what was learned from Kathy Helgens and hundreds of other patients like her, Dr. Rosenberg and his team continue to develop new forms of cancer vaccines.